Good morning, everyone. My name is Dr. Tanmay Joshi, and today we'll be talking about anxiety disorders. This is the outline of my presentation. First, we're going to talk about what is fear, what is anxiety, and what are anxiety disorders. Fear and anxiety. Fear is basically an intense emotional response to a known, external, definite, and non conflictual threat. For example, you spot a tiger in front of you. There is no conflict that this is going to be a little dangerous for you. So you spot a tiger right before your eyes, you're going to experience fear. On the other hand, anxiety, a response to a threat that is unknown, internal, vague, probably conflictual. For example, the same tiger was spotted in an adjacent village. You do not know whether you're going to face the tiger or not, but what you experienced then, probably anxiety. So fear is more often associated with surges of autonomic arousal necessary for fight and flight. There may be thoughts of immediate danger and some escape behaviors. On the other hand, anxiety is more often associated with muscle tension and vigilance in preparation for a very future danger and some cautious and avoidant behavior. What is anxiety disorder? Anxiety disorder basically is a group of mental disorders characterized by significant and uncontrollable feelings of anxiety and fear that such a person's social, occupational, and personal functions are significantly impaired. So what are the types of anxiety disorders? We'll be talking about various types of anxiety disorders, namely agoraphobia, generalized anxiety disorder, panic disorder, social phobias, and other specific phobias. First, let us go through how common is anxiety. There was a survey, the first of its kind in 2016, the National Mental Health Survey. It has shown that the prevalence of anxiety is as much as depression. Depression was found to be 2.68% in the general population, and anxiety was found to be 2.57%. The most common forms of anxiety were agoraphobia, followed by generalized anxiety disorder. Females were found to be more affected than males. Females were also more likely to relapse than males. Females, um, sorry, people in urban metros are more than 2 times likely to be diagnosed than those in rural areas. So when it was found, the factors were explored. So the factors for female preponderance would be poor social support, differential access to care, and possibly an increased tendency of worrying. The main reasons for more prevalence of anxiety disorders in urban areas were basically due to overcrowding, poor social support, social isolation, migration, and the rural areas usually have the district programs, community programs, district level programs, but urban areas do not. So those are found to be the prominent reasons. What are the causes of anxiety disorders? The causes can broadly be defined into, they can be categorized into biological and psychosocial factors. Biological factors like heritability. First degree relatives having a history of anxiety disorders increase the risk of anxiety disorders in the coming generation. Monozygotic twins having a family history of psychiatric illness. These are the causes. Other medical causes that can lead to an increase in sympathetic activity are also known to cause anxiety disorder. Can be various psychosocial factors also, like having stressful life events, certain temperamental or personality traits, childhood maltreatment like abuse or probably neglect, some parenting related factors, and some family and work related. What are the main signs and symptoms of anxiety? So there are physical and there are psychological signs. Broadly, physical signs can be dry mouth, difficulty in swallowing, palpitations, restlessness, tremors, abdominal discomfort, headaches, dizziness, maybe light or heavy headedness, choking sensations in your throat, breathlessness, muscle tightness, chest tightness, muscle tautness, excessive thirst. Psychological symptoms can be decreased concentration, where people cannot probably concentrate on work, they can't recall stuff, they can't memorize things, they have a fear of losing control, they feel apprehensive all around the day, some withdrawal from social activities, there's some irritability, insomnia, and any such. How do you identify it? How much is too much? It is usually considered a normal reaction. Anxiety is basically considered a normal reaction to a realistic threat or a danger that dissipates. Anxiety should be able to dissipate when the threat or danger is no longer present. But it is considered to be abnormal or pathological if it is excessively or persisting beyond developmentally appropriate period. Child being scared the same way when he turns into an adult would probably be considered is out of proportion to the situation that is causing it, and it interferes with the social, occupational, and important other areas of fun. How is one supposed to identify it? We'll go according to the categories of anxiety. First, say agoraphobia. Agoraphobia can be defined as a fear of places or maybe situations from where rapid exit is not possible, or it is perceived to be difficult in obtaining help. The person has a fear of being trapped and helpless. For example, it may be experienced in enclosed spaces. Enclosed spaces means movie theaters, elevators, maybe stores. It could be experienced in open spaces as well, like parking lots, bridges. Could be experienced in public transports, like buses, aeroplanes, and trains. Other type of anxiety called generalized anxiety disorder. This can be defined as a chronic, persistent, unrealistic, and excessive worry or anxiety that is impairing the daily activities of a person. People who have generalized anxiety disorder or GAD, they have a persistent, excessive, unrealistic worries associated with several signs like muscle tension, impaired concentration, and insomnia. When you see about the signs and symptoms that these people experience, they have muscle tension, restlessness, fatigue, insomnia. They have an anxiety related to the personal safety. They have trembling, sweating, palpitations, and they have a difficulty in controlling their worries. They avoid any activity or events that bring about negative outcomes or have the potential to bring about negative outcomes. And as a result of this, their personal, social, occupational life is hampered. Coming to specific phobias, what are specific phobias? Basically, these are characterized by unrealistic or unreasonable fears related to a very specific object or a situation. Exposure to the phobic stimulus, the thing that triggers anxiety or fear, it provokes an extremely immediate anxiety response, which may make form of a panic attack. Examples of such fears are fears of heights, like acrophobia, fear of closed spaces, like claustrophobia, and many such things. Spiders, dogs, name it, you have a name. Coming to a very specific type of phobia called social phobia, because it is very relevant. Social phobia is a fear of social situations where a person may be examined closely, a person may feel embarrassed, or may feel as if being judged by others. The person has negative ideas that they are being negatively evaluated by others, or they may perceive that they shall be embarrassed or humiliated or rejected or insulted by others. Main features that people experience as a result of social phobia is a very strong and persistent fear of an interpersonal situation, like that with a boss or maybe a colleague that one finds intimidating. There may be a fear of meeting unfamiliar people. There may be a fear of avoidance of situations where the person is observed to be either eating or drinking something. They fear scrutiny in these situations. There is a fear of being criticized. There is a fear of public speaking, public performance. These are the main features that are experienced in specific social phobia. Now comes panic disorders. Panic disorders are basically circumscribed events of panic attacks happen too frequently. So you have repeated panic attack, becomes a panic disorder. What is panic? Panic is a sudden, uncontrollable fear or anxiety related to a perceived threat or danger, which is usually accompanied by it becoming recurring, it is unexpected, and it is characterized by intense fear. It begins abruptly and it reaches its peak within 10 minutes. This is also accompanied by many symptoms like sweating, shortness of breath, chest pain, palpitations, choking sensations, sensation of having a heart attack, probably. There's a fear of dying that happens during this time. And some people also experience altered reality. They may perceive the world to be unreal or maybe them to be unreal themselves. Usually, all the symptoms are short lived, like all of it dissipates within 1 hour. How should anxiety disorders be managed? There are two main categories of management. The mainstay of treatment is basically psychological treatment. There are various types of psychological treatments that are given, like cognitive behavior therapies. What happens in cognitive behavior therapies is that we are focused on turning the negative and panic causing thoughts into more acceptable and positive ones. Similarly, we do with the behaviors as well. There are certain behavioral techniques that we use, like biofeedback, systematic desensitization, flooding, depending on the kind of anxiety that the person is experiencing. We also have certain relaxation techniques that we advise people suffering from anxiety disorders, like progressive muscle relaxations, yoga, meditation, guided meditation, deep breathing exercises, and then there is medical treatment. Medical treatment again involves a combination of classes of drugs, antidepressants, the broadly classified antidepressants. The name is no longer, but these molecules have been shown to cause tremendous relief in anxiety. And there are other category of drugs called benzodiazepines that are given for immediate relief. Which drug to give, when to give, all is left to the discretion of any psychiatrist or a medical practice. So this was the overview for anxiety disorders. References were the Kaplan and Sadov textbook of psychiatry, National Mental Health Survey. Thank you very much. Hope it was informative for you.